Hello friends, welcome back to my YouTube channel. ഇന്ന് ഈ വീഡിയോയിൽ ഉൾപ്പെടുത്തിയിട്ടുള്ളത് മോസ്റ്റ് ഇമ്പോർട്ടൻ്റ് ആയിട്ടുള്ളതും റിപ്പീറ്റഡ് ആയി ചോദിച്ചു വരുന്നതുമായ 100 മൾട്ടിപ്പിൾ ചോയ്സ് ക്വസ്റ്റ്യൻസും അതിൻ്റെ ആൻസേഴ്സും ആണ്. ഇതിൽ ഒരു ക്വസ്റ്റ്യൻ എങ്കിലും ഒന്നോ രണ്ടോ ക്വസ്റ്റ്യൻ എങ്കിലും നമ്മൾ സ്റ്റാഫ് നഴ്സ് ഗ്രേഡ് 2 എക്സാമിൽ ചോദിക്കുന്നില്ല കാര്യം ഉറപ്പാണ്. അപ്പോൾ എല്ലാവരും വീഡിയോ കാണുക. അപ്പോൾ നമുക്ക് ക്വസ്റ്റ്യൻസിലേക്ക് കടക്കാം. First question, anaphylactic shock treated with which of the following drug? Options are propranolol, adrenaline, enalapril, digoxin. And the answer is adrenaline. In the next question, pernicious anemia is due to deficiency of. Options are thiamine, iron, vitamin B12, folic acid. And the answer is vitamin B12. Next question. Position given for a patient with status asthmaticus in severe respiratory distress. The options are sitting upright, side lying, supine and prone. And the answer is sitting upright. In the next question. Electrolyte imbalance in the body regulated by which organ? The options are kidney, heart, parathyroid, liver. And the answer is kidney. In the next question, when lifting a patient onto a stretcher, the nurse should bend from the options are shoulder, knees, back and waist. And the answer is knees. Next question. Which of the following vaccine is routinely given in pregnancy? The options are influenza, oral polio, tetanus and rabies. And the answer is tetanus. In the next question. Which of the following does not cross the placenta? The options are heparin, morphine, naloxone, warfarin. And the answer is heparin. And the next question. If the labor ends with 2 to 3 painful contractions called, the options are difficult labor, precipitate labor, prolonged labor, normal labor. And the answer is precipitate labor. The next question, most effective way to break the chain of infection. The options are hand hygiene, wearing gloves, placing client in isolation, social distancing. Most effective way to break the chain of infection. And the answer is hand hygiene. In the next question, the priority when providing a oral hygiene to an unconscious patient to prevent. The options are aspiration, mouth odor, dental caries, oral ulceration. And the answer is aspiration. And the next question, antidote of heparin. And the options are calcium gluconate, vitamin K, protamine sulfate and atropine. Antidote of heparin. And the answer is protamine sulfate. The next question, for a comatose patient, highest priority nursing diagnosis is. The options are altered sensorium, ineffective airway clearance, impaired physical mobility, altered nutrition. And the answer is ineffective airway clearance. In the next question, most reliable index of cerebral status is. The options are pupil response, response to pain, level of consciousness, deep tendon reflex. Most reliable index of cerebral status. And the answer is level of consciousness. In the next question, which age group children engage in parallel play? The options are infant, toddler, preschooler, and schooler. Which age group children engage in parallel play? And the answer is toddler. The next question. The salivary gland secretes saliva, which contain the enzyme. The options are pepsin, ptyalin, renin, and lipase. The salivary gland secretes saliva, which contains enzyme. Answer is ptyalin. The next question. Most common cancer associated with AIDS. The options are Hodgkin lymphoma, Swing sarcoma, Kaposi sarcoma, small cell carcinoma. Most common cancer associated with AIDS. And the answer is Kaposi sarcoma. The next question. Thermoregulatory center located at. The options are pituitary, pons, medulla, and hypothalamus. Thermoregulatory center located at. And the answer is hypothalamus. And the next question. The highest level of learning is. The options are concept learning, chaining, problem solving, verbal association. Highest level of learning. And answer is problem solving. The next question. Biomedical waste management rule came into enforcement in India. The options are 1965, 1980, 1998, 2000. The answer is 1998. Next question. An obstetric emergency. The options are HELP syndrome, Gilbert syndrome, Down syndrome, Cone syndrome. An obstetric emergency. And the answer is HELP syndrome. In the next question, telling the truth is a practice of which ethical principle? The options are non-maleficence, justice, beneficence, veracity. Telling the truth is a practice of which ethical principle? And the answer is veracity. The next question. Validity of the research tool refers to. The options are feasibility, consistency, accuracy, and accountability. Validity of a research tool refers to. The answer is accuracy. The next question. Which of the following is a DNA virus? The options are hepatitis A, hepatitis B, hepatitis C, hepatitis D. Which of the following is a DNA virus? And the answer is hepatitis B. In the next question. Position given for mouth care to an unconscious patient. The options are Fowler's position, side-lying position, knee chest position, and supine position. Position given for mouth care to an unconscious patient. Answer is side-lying position. In the next question, pacemaker of the heart. The options are Purkinje fibers, bundle of His, SA node, and AV node. Pacemaker of the heart. And the answer is SA node. In the next question, normal tidal volume of lung is. The options are 500 ml, 1000 ml, 750 ml, and 250 ml. Normal tidal volume of lung. And the answer is 500 ml. The next question, the thickest layer of the uterus is. The options are perimetrium, myometrium, endometrium, and peritoneum. The thickest layer of the uterus is. And the answer is myometrium. The next question, the chief regulator of immune mechanism is. The options are plasma cell, lymphocytes, helper T cells, and suppressor T cells. The chief regulator of immune mechanism. The answer is helper T cells. The next question, the first event of puberty in girls is. The options are telarche, pubarche, menarche, and menopause. The first event of puberty in girls is answer is telarche. The next question, hormone essential for milk ejection. The options are estrogen, oxytocin, prolactin, and prostaglandin. Hormone essential for milk ejection is, and the answer is oxytocin. The next question, ovulation induced mainly by, the options are progesterone, FSH, LH, and estrogen. Ovulation induced mainly by, answer is LH. The next question, sleeping pulse rate is classically increased in, the options are hyperthyroidism, hypoparathyroidism, hypothyroidism, hyperparathyroidism. Sleeping pulse rate is classically increased in, the answer is hyperthyroidism. The next question, antibiotic used as a chemotherapeutic agent. The options are augmentin, vincristine, actinomycin, streptomycin. And the answer is actinomycin. And the next question, pregnancy mask. The options are Lina nigra, butterfly rash, colasma, and erythema. Pregnancy mask. And the answer is colasma gravidarum. The next question, HCGs produced by, the options are cytotrophoblast, decidua, mesoderm, and syncytotrophoblast. HCG is produced by, and the answer is syncytotrophoblast. The next question, ribbon-like stool seen in, the options are intussusception, Hirschsprung's disease, ulcerative colitis, and diverticulitis. Ribbon-like stool seen in, and the answer is Hirschsprung's disease. Next question, therapeutic serum level of lithium. The options are 0.4 to 1.6 MEq per liter, 0.6 to 1.8 MEq per liter, 0.8 to 1.2 MEq per liter, and 1.2 to 1.4 MEq per liter. The answer is 0.8 to 1.2 MEq per liter. Next question, increased pulsation of lateral vaginal fornices during pregnancy. The options are Jackmer sign, Chadwick's sign, Goodell sign, and Osiander sign. Increased pulsation of lateral vaginal fornices during pregnancy. And the answer is Osiander sign. The next question, which of the following is a fundamental symptoms of schizophrenia? The options are ambivalence, delusion, hallucination, and mannerism. Which of the following is a fundamental symptoms of schizophrenia? And the answer is ambivalence. The next question, absence of recognizable P wave in ECG indicates. The options are atrial fibrillation, ventricular fibrillation, sinus arrhythmias, sinus rhythm. Absence of recognizable P wave in ECG. The answer is atrial fibrillation. The next question, misinterpretation of external stimuli. The options are hallucination, depersonalization, delusion, and illusion. Misinterpretation of external stimuli. And the answer is illusion. The next question, duration of full-term pregnancy. And the options are 250 days, 280 days, 300 days, 220 days. Duration of full-term pregnancy. And the answer is 280 days. Next question, paralysis of lower half of the torso and both legs. The options are quadriplegia, hemiplegia, paraplegia, and tetraplegia. And the answer is paraplegia. The next question, test used to detect typhoid. The options are Vidal test, Millard's test, Kahn test, and Lepto test. And the answer is Vidal test. The next question, electrolyte imbalance potentiate digitalis toxicity. The options are hyperkalemia, hypokalemia, hyponatremia, hypernatremia. And the answer is hypokalemia. The next question, blood clots floating in the circulating blood. The options are emboli, thrombus, plague, and aneurysm. Blood clots floating in the circulatory blood. And the answer is emboli. Next question, drugs used for aversion therapy in alcoholics. The options are dantrolene, bendropin, bromocriptine, and disulfiram. The answer is disulfiram. The next question, drug of choice of diabetes insipidus. The options are oxytocin, vasopressin, Lasix, and calcium gluconate. Drug of choice of diabetes insipidus. The answer is vasopressin. The next question, covariary uterus occur in. The options are placenta previa, placental abruption, DIC, and hydatidiform mole. And the answer is placental abruption. In the next question, Employees State Insurance Act was in. The options are 1975, 1976, 1948, 1952. And the answer is 1948. The next question, the condition in which patient is conscious but non-response to environment. The options are delirium, stupor, coma, and confusion. The next answer is stupor. The next question, unintentional filling of gaps of memory with untrue or fanciful ideas. The options are confabulation, amnesia, deja vu, and hyperamnesia. And the answer is confabulation. The next question, an ototoxic drug. The options are aspirin, digoxin, chlorpromazole, dapsone. And the answer is aspirin. The next question, during labor, station of the fetal head assessed in relation to. The options are ischial spine, ischial tuberosity, sacral promontory, pelvic brim. And the answer is ischial spine. The next question, urethral meatus is on the penile dorsal surface is. The options are paraphimosis, epispadiasis, phimosis, and hypospadiasis. And the answer is epispadiasis. And the next question, huge tumor-like overgrowth of scar tissue. The options are cankeroid, cellulitis, nodule, and keloid. And the answer is keloid. The next question, percentage of water in human body. The options are 60%, 80%, 35%, and 50%. And the answer is 60%. The next question, main action of antacid in treating peptic ulcer disease. The options are increase gastric motility, H2 receptor blocker, inhibit gastric acid secretion, increase histamine release. And the answer is inhibit gastric acid secretion. In the next question, respiratory center is stimulated by. The options are oxygen, blood pH, carbon dioxide, and lactic acid. And the answer is carbon dioxide. The next question, first AIDS case in India was reported in the year. The options are 1987, 1982, 1992, 2002. And the answer is 1987. The next question, World No Tobacco Day is observed on. The options are 5th June, 31st May, 10th August, April 7th. World No Tobacco Day. And the answer is 31st May. And the next question, absence of ganglion cells in colon is feature of. The options are ulcerative colitis, Hirschsprung's disease, anorectal malformation, Reis syndrome. And the answer is Hirschsprung's disease. The next question, DPT vaccine administered via. The options are oral route, IM route, subcutaneous and IV route. DPT vaccine administered via. The answer is IM route. The next question, father of antiseptic surgery is. The options are Joseph Lister, Louis Pasteur, William Harvey, Ronald Ross. Father of antiseptic surgery. The answer is Joseph Lister. The next question, vaccines and toxoids are. The options are natural immunity, active immunity, passive immunity and acquired immunity. Vaccines and toxoids are. The answer is active immunity. The next question, the constant phase in a menstrual cycle is. The options are proliferative phase, menstrual phase, ovulation phase and luteal phase. The constant phase in a menstrual cycle. The answer is luteal phase. Next question, inhalation of a cotton dust over a long period of time causes. The options are anthracosis, bisonosis, bagasosis and silicosis. And the answer is bisonosis. In the next question, average blood loss in a normal menstrual cycle is. The options are 150 to 200 ml, 100 to 150 ml, 50 to 100 ml, 200 to 250 ml. And the answer is 50 to 100 ml. The next question, postpartum hemorrhage is defined as a minimum blood loss of. The options are 1000 ml, 1500 ml, 250 ml and 500 ml. And the answer is 500 ml. The next question, increased number of new cells is called. The options are atrophy, hyperplasia, metaplasia, hypertrophy. And the answer is hyperplasia. The next question, endocrine gland present in the base of the brain is. The options are parathyroid, pituitary, pancreas and thyroid. Endocrine gland present in the base of the brain. And the answer is pituitary. And the next question, fetal kidney start producing urine at. The options are 10 weeks, 12 weeks, 14 weeks and 8 weeks. Fetal kidneys start producing urine at. And the answer is 12 weeks. The next question, a client on anticoagulant therapy is monitored for. The options are nausea, chest pain, insomnia and hematuria. A client on anticoagulant therapy is monitored for. And the answer is hematuria. In the next question, calorie obtained from 1 teaspoon of sugar. Options are 5, 15, 20 and 50. Calorie obtained from 1 teaspoon of sugar. And the answer is 20. In the next question, client with hypoventilation is prone to develop. The options are metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. The answer is respiratory acidosis. The next question, periods of hyperapnea alternates with periods of apnea. The breathing pattern is termed. The options are Kussmaul's respiration, Kine-Stroke respiration, bradypnea and tachypnea. The answer is Kine-Stroke respiration. The next question, a client with ileostomy requires dietary supplementation with. The options are fiber, sodium, potassium, and vitamin B12. And the answer is vitamin B12. The next question, major cause of atonic postpartum hemorrhage. The options are infection, retained products, SLE, and jaundice. Major cause of atonic postpartum hemorrhage. The answer is retained products. The next question, most accurate area to check pulse rate in an infant is. The options are carotid artery, brachial artery, temporal artery, and apex of the heart. And the answer is apex of the heart. The next question, which of the following is a mood stabilizer? The options are Librium, lithium carbonate, tofranil, haloperidol. The answer is lithium carbonate. The next question, dance sign indicates. The options are induced susception, pyloric stenosis, Hirschsprung's disease, none of the above. The dance sign indicates. The answer is induced susception. The next question, pilocarpine drops are used in the treatment of. The options are acute iritis, acute uveitis, myopia, and glaucoma. Pilocarpine drops are used in the treatment of. The answer is glaucoma. The next question, digoxin causes. The options are optic neuritis, retinal pigmentation, yellow vision, scotoma. The digoxin causes. The answer is yellow vision. The next question, nervous system derived from. The options are ectoderm, endoderm, ectomesoderm, endomesoderm. Nervous system derived from. And the answer is ectoderm. The next question, all stages of rash seen in. The options are smallpox, chickenpox, measles, and typhoid. All stages of rash seen in. Answer is chickenpox. The next question, gray baby syndrome is associated with. The options are sulfadiazine, clindamycin, chloramphenicol, and vancomycin. Gray baby syndrome is associated with. Answer is chloramphenicol. The next question, antagonist of benzodiazepine. The options are naloxone, clozapine, N-acetylcysteine, flumazenil. Antagonist of benzodiazepine. And the answer is flumazenil. And the next question, proponent of theory of learning by conditioning. The options are Sigmund Freud, Pavlov, Pinel, Kraepelin. Proponent of theory of learning by conditioning. And the answer is Pavlov. That is Ivan Pavlov. The next question, liver enzyme help in the bilirubin metabolism. The options are urobilinogen, pancreatic lipase, glucuronide transferase, and trypsin. Liver enzyme help in bilirubin metabolism. The answer is glucuronide transferase. The next question, common site of metastasis of colorectal cancer. The options are bone, spine, lungs, and liver. Common site of metastasis of colorectal cancer. The answer is liver. Next question, stress ulcer secondary to brain lesion. The options are Cushing ulcer, curling ulcer, duodenal ulcer, none of the above. Stress ulcer secondary to brain lesion. The answer is Cushing ulcer. The next question, which of the following is a hypotonic solution? The options are DNS, RL, 0.45% of sodium chloride, 5% of dextrose in RL. Which of the following is hypotonic solution? The answer is 0.45% of sodium chloride. Next question. Lifespan of RBC in newborn is, the options are 120 days, 140 days, 80 days and 100 days. Lifespan of RBC in newborn. And the answer is 80 days. The next question. MACEWE'N'S sign is a manifestation of, the options are hydrocephalus, meningomyelocele, cerebral palsy and meningitis. MACEWE'N'S sign is a manifestation of, and the answer is hydrocephalus. The next question. Benign tumor of thyroid gland is termed as, the options are goiter, Hashimoto's disease, Plummer's disease and Graves' disease. Benign tumor of thyroid gland is termed as, and the answer is Plummer's disease. The next question. Group of drug which regulate the heart rate can be termed as, the options are inotropic agents, chronotropic agents, dromotropic agents, arrhythmic agents. Group of drug which regulate the heart rate can be termed as, the answer is chronotropic agents. The next question. The most sensitive measure of growth is, the options are height, weight, head circumference, chest circumference. The most sensitive measure of growth is, and the answer is weight. The next question. Signs of meningeal irritation include all except neck rigidity, Rudzinski sign, Babinski sign and Kerning sign. Signs of meningeal irritation include all except, and the answer is Babinski sign. Next question. Polyhydramnios is usually associated with, the options are esophageal atresia, ASD, congenital megacolon and Down syndrome. Polyhydramnios is usually associated with, and the answer is esophageal atresia. The next and last question. Superego functions on the basis of, the options are pleasure principle, reality principle, perfection principle and moral principle. Superego functions on the basis of, and answer is perfection principle. Thank you friends. Thank you for watching. Please subscribe my channel for more videos.